Welcome to the Health Channel, all health, all the time. I am Cynthia Demas. Consider this: poor choices like underage drinking, risky sexual behavior, and delinquency could all be linked to how much sleep an adolescent gets. Joining me now to talk about his research on this topic is Dr. Ryan Meldrum, an associate professor of criminology and criminal justice at Florida International University, an academic affiliate of Baptist Health South Florida. Welcome to the show. Thanks for being here.
Happy to be here.
Yeah, so you've done a lot of research on this. You're still doing the research.
Yes.
Where does it sit?
Yeah, so I've been doing research on sleep as it relates to delinquency for about 5 years, and I'm continuing to do research on it.
And tell me why. Why did you pick this area? Did you find it was under-researched, or did you have a particular interest in it?
Yeah, so criminologists, sociologists, psychologists for decades have had an interest in understanding the different factors that can contribute to delinquency and substance use. But it's only been more recently that they've started to focus upon the issue of sleep. But for me, if you think about, we spend anywhere between a third to a quarter of our life asleep. So to think that that wouldn't somehow have an impact on behavior, in addition to health, that's what really intrigued me and kind of got me interested, along with my more general focus on delinquency. Super
interesting. We do want to let viewers know that they can participate in our conversation. Feel free to call in if you have a question for the doctor, 855-796-4475, 855-796-4475. Today we are focusing on the link between sleep and delinquency. And you are a Ph.D., Dr. Ph.D.
Yes.
in what?
Criminology and criminal justice.
Okay, and this is his topic, and this is something that he's really been focusing on. As we talk more about the lack of sleep and what it can mean for adolescents, let's see how much sleep, how much kids really need. Take a look.
This mom has it right. Bedtime reading is part of a routine to help her kids get a good night's sleep.
We know that children who don't get enough sleep don't grow and develop as they should. They can have developmental delays in growth and mental capability.
So how much sleep do kids need? Mayo Clinic Family Medicine Dr. Alva Roche Green says the American Academy of Pediatrics has endorsed the American Academy of Sleep Medicine's new recommendations, which are as follows. Kids 4 to 12 months need 12 to 18 hours, 1 to 2 years, 11 to 14 hours, 3 to 5 years, 10 to 13 hours, 6 to 12 years, 9 to 12 hours, and teens ages 13 to 18 years, 8 to 10 hours. For the little ones, nap time is included in those totals. Now, how do you get your kids to have what they call good sleep hygiene? For one thing,
so we recommend that you cut off all media devices at least 30 to 60 minutes prior to going to sleep.
And like this mom, establish a bedtime routine.
Okay, and as we talk about lack of sleep in kids, are we talking about number of hours, or are we talking about quality of sleep?
Researchers will generally distinguish between 3 different ways in which they'll study sleep.
Okay.
Total sleep time, or the number of hours that somebody is sleeping, is one approach. A second approach is the overall quality of the sleep, and also what we would call sleep latency. Sorry.
Sleep latency?
Onset latency. So basically how long it takes for somebody to get to sleep.
Okay.
And then how well they are able to stay asleep.
Okay.
Once they get to sleep.
I know even on your iPhone now they have the alarm. Instead of having an alarm to wake up in the morning, they have a bedtime alarm of when to go to bed.
Right.
Right? Is this kind of what we're seeing, where we're going with all of this?
Yeah, and you can even see with other technology on the phones, they now have the settings where you can have the light on the screen dim and be the softer colors, so that you're not getting more of that harsher light. Really, the blue light is what is the wavelength that really impedes the body's ability to signal to itself it's time to start preparing to go to bed.
Okay, so let's talk about your research and what ages are you focusing on?
So I'm focused mostly on middle school students and high school students. Part of that is with my broader interest in delinquency, that we see that the onset of substance use and engagement in serious forms of delinquent behavior really doesn't emerge until middle school and then really ramps up in the high school ages. So I focus upon delinquent behavior, substance use. There are researchers who will focus upon earlier childhood sleep patterns and how that relates to what we would call externalizing behavior. And externalizing behavior are things that you can consider to be precursors to delinquency. So things like slapping other kids, lying to parents, being fidgety, unable to sit still. So those behaviors that you would think would be developmentally those that would eventually potentially turn into delinquent behavior.
Well, if you're measuring, if hours and quality, and then are such a, obviously you can measure hours. I know, my child goes to bed roughly at this time, they wake up roughly at this time, they sleep 8 hours, hopefully more. But how do you know the quality of sleep they're getting? Did they had a great dream? Is that a good sign of great sleep? How do you know?
All right, so one way that we can measure the quality of sleep is through simple survey questionnaires asking adolescents, when you get to sleep, how difficult is it for you to stay asleep? Do you feel like you're getting restful sleep? And that's going to be somewhat subjective, and it's not necessarily going to be completely accurate. So what we see are that there are these technologies that come out, basically amped up version of Fitbits and Apple Watches called actigraphy monitors that can actually enable you to track what time you actually fall asleep, how many times you wake up in the middle of the night or are restless. And even some of the bed technology now enables you to track that type of stuff on your phone.
Okay. Let's also touch on the other part of the research that is measuring delinquency and substance abuse. Earlier on the Health Channel, we sat down with a doctor and chief of police, and we talked about Florida teen behaviors.
Let's go ahead and look at some of these numbers, some of these statistics that we found that affect, they're at a national average. These are some where Florida stands and Florida teens. And I would love for you to touch on them and talk to us a little bit about that. I mean, we're seeing the sex before age 13, the SEPA, which we've talked about, weapons at school. Chief, I know this is something that is very big right now going forward, and TVs per day. How does this all affect kids and teen health?
I mean, from a law enforcement standpoint, a lot of these issues that we see, both at the teens, preteens, and then in the college time when kids are coming back onto campus, is because they haven't been exposed to some of these kind of good practices, if you will, they're really at a disadvantage when they're dealing with real life or reality, as I say. Every once in a while, reality hits close to home. So as you see in some of those examples, they haven't really had I don't want to say immaturity, but they haven't had the experiences through other means that they've had prior to going out into the world, so to speak. When we give somebody a driver's license at 16 years old and send them out, they are going out into the world. They are going to experience it on their own. They have to be both obviously prepared to know how to drive, but also how to cope with aggressive driving from somebody else, taking responsibility for everybody else that's in the car because they are. So it is a much bigger step. And parenting, I think, is part of it. I think, what we used to get in school, the teaching, the driving, things like that, has kind of been either set aside or narrowed in its focus. So, these are real life educations. When you tell an 18-year-old child that they are an adult, then this is not like a juvenile crime anymore. It's an adult. You are responsible, even if you're living at home. That's quite a wake-up call when they come across us. And, they're like, well, just take me home to mom and dad. Well, it's not the way it works anymore.
So in your research, how did you break down delinquency and substance use?
So there's three main ways that you can measure delinquency and substance use. One is to use official records. So kids get picked up, arrested, get processed by the juvenile justice system. Another way is through victimization surveys, when we talk about types of delinquency in which there's an identifiable victim. The primary way in which criminologists typically will measure delinquency and substance use is through self-reports. So we actually ask adolescents to tell us, how often do you use alcohol, tobacco, marijuana, more recently vaping, things like that. Typically asking them, within the past 30 days, have you used substance X, Y, or Z? And we oftentimes will measure self-reported delinquency as well in that same way, where we'll ask kids to tell us, have you stolen anything? Yeah, stolen, trespassed, got into fights.
What kids do you have access to ask these questions to? Can you go to any school, or who are these kids?
So it depends upon the study being done, but there are several large-scale national studies that will select middle school and high school students from around the country to fill out these survey questionnaires. Here in Florida, we have the Florida Youth Substance Abuse Survey, which is administered each year, overseen by the Department of Children and Families and the Department of Health. And that collects data annually for anywhere from 10,000 to 50,000 students every year.
Okay. And we're going to talk about the biggest reasons kids don't get enough sleep and how much sleep should they get. We still got a lot of ground to cover here. You're watching the Health Channel, All Health All the Time on South Florida's PBS. If you have a question for us, please call in now, 855-796-4475, 855-796-4475. We're also going to talk about start times at school and are they effective or ineffective? You visit us at the Health Channel, allhealthtv.com, and please download the Health Channel app for your mobile device or smartphone. It's free and available at the App Store or Google Play. So much to cover still. Don't go anywhere. We'll be right back.
My name is Dr. Deepa Sharma, and I'm a primary care physician with Baptist Health Primary Care. I actually really enjoy the Health Channel. It's a way for physicians such as myself to deliver important information to the community and kind of close that gap of the unknown and fear that often, clouds medicine and doctors. So sometimes if a patient is interested in seeing a specialist but doesn't know much about the specialty, I can refer to the Health Channel, the website, and say, listen, there's plenty of information, it's reliable, these are board certified physicians who can provide information and kind of give you a sense of what to expect. All the physicians who come onto the Health Channel are doing so because they want to educate the community, they want to help patients, and they want patients to feel comfortable. Having this resource to help patients have a place that they can go to that's trustworthy is priceless.
You listen when your body says, I'm tired, or I'm hungry. What if your body said something else might be wrong? Gynecologic cancers, cervical, ovarian, and uterine cancers have symptoms, so pay attention. If your body says something may be wrong, please listen. If it goes on for 2 weeks, see a doctor. It may be nothing, but find out, learn the symptoms, get the inside knowledge about gynecologic cancers.
Look at you. You're at the top of your game. At work or at play, you're unstoppable. Nothing can throw you off track. Oh, hey, she's cute. Nice going, man. Things are going great for you. You've earned a night out. Good drinks, good friends. Yeah, we can go ahead and call this a good night. Wait, is that your car? Uh-oh. Not smart. Yeah, I saw that coming. Say goodbye to her. Ouch, that'll hurt your bank account. You're looking at around 10 grand in fines, legal fees, and increased insurance rates. I hope you like eating frozen dinners. Alone. Let's try this again. Smart move. Because buzz driving is drunk driving.
Welcome to the Health Channel, all health, all the time. I am Cynthia Demas. Joining us is Dr. Ryan Meldrum, an associate professor of criminology and criminal justice at Florida International University. And we would love to know your questions you have for him. Call us 855-796-4475, 855-796-4475. Today we are talking about the link between sleep and societal behaviors in adolescence. What can you tell us about how much sleep young people need and how much sleep young people are getting?
So if you're talking about school-age children, those in elementary school and middle school, the recommendations basically are around 9 to 10 hours.
Okay.
When you get into high school, you're talking about 8 hours generally. We talk about that conventional wisdom, getting the 8 hours of sleep at night. What I can tell you is that a very large percentage of adolescents are not hitting those marks.
Okay.
So the most recent data from the Florida Youth Substance Abuse Survey tells us that about 40% of middle school and high school students together are getting 8 hours of sleep at night. And if you look at students who are getting even less sleep, about a quarter of adolescents are getting less than 6 hours of sleep at night.
Why?
For a variety of reasons. Technology in the bedroom is probably one of the biggest culprits. Kids that are going to bed with their phone, going to bed with their tablets. The blue light that gets emitted from those devices, and as well from TVs, interferes with the release of the hormone melatonin. And melatonin is that hormone that signals to the body it's time to start preparing for sleep. So with the blockage of the release of that hormone, it makes it more difficult for adolescents to get to sleep. So that's one of the big things is technology use.
Okay, and you were talking about technology, of course. When you say technology, you're talking about everything in the room that lights up, or mostly the cell phone, or you got your cable system over there, and you got all this other stuff going on. That counts also. Yeah,
well, the practice is to make the bedroom for sleeping.
Yes.
If you have TVs in bedrooms, if you're taking your phone with you into the bedroom and watching videos on it, or if you're watching videos on your tablets and your iPads, all of that is going to impede the body's ability to start to go to sleep. And even night lights, it's recommended that night lights get placed outside of a bedroom in adjacent hallways. And if you're going to have a bulb, it shouldn't necessarily be a white bulb, it should be a red bulb, because it's that the wavelength of that red light is going to be less disruptive to trying to get to sleep. And
also, if you do get up in the middle of the night to use the restroom or something, they say you shouldn't even read your phone, because then that starts stimulating everything, right?
Yeah, exactly, because the whole idea is that your brain is winding down. So any stimulation that you're giving yourself in the middle of the night is going to make it more difficult to get back to sleep.
Okay, and so let's talk about the factors for lack of sleep among adolescents, and kind of go through what the factors are that we're dealing with here. Use of technology, we touched on that.
Yeah, of course. Yeah, so another thing is the bedroom temperature. It's not something that people might necessarily think about readily, but experts generally recommend that the bedroom should be around 65 degrees.
Whoa, that's so
for
cold.
Optimal sleep. I know.
What?
I know. My wife would say the same thing.
60. Why? So you shiver all night?
Well, so the idea is that the body has to be able to drop a few degrees to go to sleep.
Okay.
So if you are getting into a bed in which is a really warm bedroom, it's going to make it more difficult for your body to cool down.
Okay.
So that's a key issue. And of course, in the context of South Florida, trying to keep a bedroom temperature at 65 degrees in the middle of the night is going to, cause
kill your power bill.
Yeah, skyrocket your power bill. So, that certainly is a geographic thing that would come into play.
Okay. Wow, 65 degrees.
Yeah.
I didn't know that. Light in the bedroom at night. What is that?
So again, ambient light that's coming from street lights outside, especially in urban areas where you have a lot of light pollution taking place, that again is going to make it more difficult for the body to wind down, to want to go to sleep, and then to get back to sleep in the middle of the night. So things like blackout shades over windows are one way in which you can really create that dark environment to get sleep.
Like a little cave for a bear. I love that. And inconsistent or no rules about bedtimes, bad idea, right?
Yeah, and parents really want to start at an early age to develop proper sleep hygiene habits. Setting consistent bedtimes, getting up at the same time each day as well is another way in which you can develop those healthy routines. But parents really need to be steadfast in making sure that they are getting their kids to sleep at an adequate time, which I know becomes hard as kids transition from middle school to high school. they start getting granted more freedom and more autonomy. But parents still need to make sure that they're able to ensure their kids get, practice healthy sleep habits.
Okay, and there's more to lack of sleep than the bedroom environment. Tell us a little bit about the community and household factors, things like that.
Yeah, so you can think about the immediate factors within the bedroom itself that are going to impact sleep, but the broader context in the home environment, as well as the community environment and the school as well, can also impact sleep. So we know, for example, that kids who live in neighborhoods where there's a large amount of community violence, where they might have either be aware of it or witnessed violence, is something that can trigger stress hormones, trigger things like cortisol. And cortisol is that hormone that wakes your body up in the morning, right? With melatonin being the hormone that tells you to go to sleep at night, if you have elevated levels of cortisol in your system when you try to go to bed at night, it's going to be more difficult to try to do that. In the school context, getting bullied is a big thing. It leads you to feel less safe and more anxious. Kids feel less comfortable going to school, and that anxiety again can kind of feed into those negative emotions and the stress that can result from those types of experiences.
So really anything that kind of scares you or bothers you in the day will haunt you at night.
Yeah.
Yeah. So you have to kind of protect your kids against those things, right?
Yes.
That's the fix for it?
Yeah, that's one fix. There's only so much that can be controlled by parents. Obviously, larger efforts to try to reduce community violence are going to be something that can help to improve not just sleep, but a wider variety of other child behavioral outcomes.
Well, according to the Centers for Disease Control, youth violence is a public health problem. Take a look at this.
Youth violence occurs when young people intentionally use physical force or power to threaten or harm others. It is a public health problem that is preventable. Bullying, fighting, threats with weapons, and gang-related violence are all forms of youth violence. This problem affects thousands of young people, their families, and communities each year. It impacts all genders, races, ethnicities, households across income levels, and communities, including urban, suburban, rural, and tribal areas. Youth violence happens every day. Every 24 hours, about 15 youth are victims of homicide. Over 1,300 youth are treated in emergency departments for injuries from physical assault. It is important to identify the things that put people at risk for experiencing youth violence. Some risk factors include previously experiencing violence, harsh discipline at home, social rejection, poverty. The good news is youth violence can be prevented. Factors that protect young people from violence include having problem-solving skills, positive relationships with adults, and a commitment to school. There are 6 strategies that help keep youth safe and healthy. They include promote family environments that support healthy development, provide quality education early in life, strengthen youth skills, connect youth to caring adults and activities, create protective community environments, intervene to lessen harms and prevent future risk.
And we'd love to hear from you, love to hear your input, any questions that you have. The number to join in the conversation is 855-796-4475, 855-796-4475. We're talking about sleep and how it affects children and as they are kids into high school and into adulthood as well. Lastly, we do want to touch on alcohol consumption and drinking caffeine before bed. This is a common issue with adolescents today, yes?
Yeah, so about 1 in 5 high school students report that they've used alcohol within the past 30 days. And the key thing with alcohol is that also is going to disrupt sleep. And it can be a cyclical pattern where because kids are not getting adequate sleep, they're more likely to engage in risky behavior, have reward centers of the brain be more activated to seek out things like alcohol. But then as a result of drinking alcohol, particularly at night when teenagers tend to drink alcohol, that's going to disrupt sleep. You might think that, well, kids that are engaging in binge drinking, they're passed out, right? Looks like they're sleeping, but they're not getting that deep, restful, rapid eye movement sleep that you really want to get to restore yourself the next day. Caffeine is another big issue, especially with the amount of energy drinks that are now marketed to teenagers. The recommendation is that adolescents should have no more than about 100 milligrams of caffeine per day.
What's that? What's 100 milligrams?
So
like a half a Coke?
So your average 12-ounce soda will have 50 milligrams.
Okay.
So if you take something like a Big Gulp that has 32 ounces, you've already exceeded the daily recommendation. If you talk about something like a 5-hour energy drink that has about 300 milligrams of caffeine in it.
And what about taking caffeine in a certain time of day? So if you take it later in the day, it'll affect your sleep more?
Yeah, so caffeine will remain in the system, and it actually peaks in the system around 3 or 4 hours after consuming it.
Oh.
So if you're going to have caffeine, you want to tend to have it earlier in the day so that it won't disrupt sleep later.
Okay. Well, coming up, we will get a closer look at how lack of sleep can affect adolescents on a daily basis. And we're also going to touch on school start times, something that's dear to my heart here. Are they starting too early for the age of your children? We'll discuss that. You're watching the Health Channel, all health, all the time, on South Florida's PBS. If you have a question, join us, 855-796-4475, 855-796-4475. And remember, you can take the Health Channel with you wherever, whenever, by visiting our website, allhealthtv.com. And go ahead and download the Health Channel app for your mobile device or smartphone. It's free and available at the App Store or Google Play. We'll be right back. Don't fall asleep.
Pick any problem you have with anybody. Anybody who's doing something you don't want them to do or not doing something you want them to do, anything, and you really only have 3 options. In our approach, we call these your 3 plans. We call it Plan A when you try to impose your will to make the person do what you want them to do. And if you have power over that person and they have decent skills related to problem solving, flexibility, and frustration tolerance, you might get away with it and it would go okay. What are your other options? To try to collaborate to solve a problem in mutually satisfactory ways. And your third option, to drop it. Solve it the way the other person wants. Drop your expectation, not forever, but for now. And parents, teachers, all of us often find ourselves resorting to Plan A to try to impose our will, and if it doesn't work out well, it gets ugly on us, we revert to Plan C. But there's a third option, and the third option is what we call Plan B. And here's simple but not easy. Plan B has 3 basic ingredients to it. Ingredient number 1 is where we teach people to listen hard to the other person, to ask questions, to take guesses, to reflect what they've heard from the person, and to reassure them that this is not some tricky form of Plan A, which we often do. We often do what I call empathy followed by Plan A. No, first you're getting the other person's concern or perspective on the table, and it's only once you do that you move to the second ingredient of Plan B, where you share your concern, not your solution to the problem, but your concern. And only once you have 2 sets of concerns on the table do you move to the third and final ingredient of Plan B, where you invite the person to collaborate to arrive at mutually satisfactory solutions to the problem.
Us. It's what this country is made of. But right now, our bond is framed. How do we get back to us? The Y fills the gaps and bridges our divides. Support your local Y today. Because where there's a Y, there's an us.
Welcome back to the Health Channel, All Health, All the Time. I'm Cynthia Demas. Joining us now is Dr. Ryan Meldrum, an Associate Professor of Criminology and Criminal Justice at Florida International University. If you have a question for us, we ask you to call 855-796-4475, 855-796-4475. And we do have a caller on the line right now. We have Luca from Pinecrest. Luca, are you there?
I'm here. Hello.
Hello. What is your question?
So I have a boy and a girl. So I'm wondering if there are any gender differences in the amount of sleep boys and girls are getting, or should be getting, and if this relates in any way to their behavior, misbehavior.
Gender differences.
So there are no differences in recommendations for the amount of sleep that boys versus girls should be getting during adolescence. And in terms of patterns of how much sleep they're actually getting, we do see that it is fairly even in terms of both boys and girls, on average, not getting sufficient amounts of sleep. What you might see in terms of the effects of sleep deprivation is you might have girls engage in more internalizing behaviors, so things like anxiety and depressive symptoms. That's how sleep deficits can manifest themselves. Whereas for boys, you might see the more externalizing behavior, getting in fights, where you lack that self-control as a result of sleep deprivation, can lead you to get into physical altercations where if you were getting adequate sleep, you might have that ability to kind of stop, think about, well, is this something I really want to do? What are going to be the consequences of doing that behavior?
So if you do get enough sleep, you have the wherewithal and kind of that sense of calm.
Yeah.
Because you feel better. It's obvious, but it takes a lot of research to get there, right? Hey, Luca from Pinecrest, thank you so much for your call. Today we are talking about sleep and adolescence. And let me ask you, based on your research, the effects range from lower grades to life-threatening.
Yes, so it can be anything from simple lapses in attention spans and focus, up to when you talk about things like teenagers who are driving to school that are sleep deprived. One of the things that is really dangerous is what we call micro sleeps, where you will actually physically shut down for a half a second or a second and lose all motor function, and then you'll snap back and wake back up. And those micro sleeps can be as dangerous, if not more dangerous, than drunk driving behavior at night. So to the extent that we can even increase sleep among adolescents by a half an hour or an hour at night, you can kind of pull people out of that really dangerous range of inadequate sleep to avoid some of these more dangerous outcomes.
And that can happen usually if you're at a stoplight or a stop sign and you just close your eyes for a second and you realize I actually fell asleep.
Right, but it can also happen in the middle of driving when it's most dangerous.
Oh, wow.
And that can end up, you can run into somebody, veer off the road if you're going around a corner. So it can be really problematic. Okay,
and there are some important consequences. Let's go through these, starting with poor concentration and lack of attention. So poor concentration, you're not going to be able to learn at school.
Yeah, and that's one of the biggest functions of sleep, is it takes what you have been exposed to during the middle of the day, all that stimuli, and for school-age children, all of that knowledge that they're learning in the middle of the day. Sleep helps to consolidate that information and helps transfer it from short-term memory into long-term memory. And so when you aren't getting adequate sleep, the efficientness of that is going to decrease.
And good teachers will say, what time did you go to bed last night?
Well, they can oftentimes tell who was not getting adequate sleep because they're the ones falling asleep in class.
Or acting out, right. Especially the boys. Daytime sleepiness, what's that about?
Yeah, so some of what we were talking about was this idea that if you're not getting adequate sleep, that your body is going to try to compensate in the middle of the day. That's where you're going to see those kids that are dozing off in the middle of class. And that itself also is going to then impede the child's ability to be learning if they aren't, again, able to focus and pay attention in class.
Okay. And we touched on poor school performance, auto accidents, you touched on that, and then self-control, of course, we touched on that as well.
Yeah. Yeah, and that really was kind of one of the broader interests of my research that I've started out with in my careers, looking at what causes a lack of self-control. So when I started learning about the research on sleep and how it can affect executive functioning and the ability to concentrate and maintain attention, that kind of caused me to naturally gravitate towards focusing upon sleep as a potential cause of low self-control.
And what percentage does the sleep play into it? So if somebody is constantly losing control of their emotions. You know, you have to figure a part of it is sleep, a part of it could be hereditary,
Yes.
a part of it could be learned behavior. Daddy does that, so I'm going to do it, right? So how much does sleep play a factor into this?
How much does it change the needle?
Right, is it 10%, is it 90%? What are we looking at here when it comes to sleep?
Yeah, so I mean, the biggest factor when we're talking about sleep, it is hereditary. We know that there are people that are the night owls, the people that are the morning people that get up. Self-control also is certainly learned behavior, parental monitoring, interactions with peers. Right? So there are a variety of factors beyond sleep that will impact self-control. And I would say that the amount of research on the link between sleep and low self-control is still in its infancy. So I really couldn't give like a precise estimate of how much is the needle actually moving as a result of sleep. We're kind of just trying to get a baseline at this point of how is it actually moving the needle. And thus far, the research does suggest that it is consequential.
And how cumulative is it? I mean, are we talking, we're seeing this loss of self-control, substance abuse, and all these negative qualities. Is this because you, for a month, don't sleep enough, 2 months don't sleep enough, a year? I mean, I can't imagine a few bad nights' sleep is going to affect the outcome of your life. What are we looking at? Are we looking at just a pattern here throughout the years? How did you do your research on that?
Yeah, so it would really be sustained patterns of inadequate sleep. If you're starting out in elementary school and you're not going to sleep until 11 o'clock at night, and you might be getting up at 7 or 8, right? You're already a couple hours below the recommended range. And so those early sleep practices that are going to be really detrimental to getting adequate sleep in elementary school, those are compound and probably fold over into middle school and high school. So the idea is that, as you were saying, this is some like a cumulative effect that can start in early childhood. And then when you get into high school, when you start to see this emergence of delinquent behavior, that's where sleep becomes really even more important.
Let's talk a little bit about more the consequences for the lack of sleeping among adolescents. We talked a little bit about substance abuse and delinquency, but also obesity is a problem.
Yeah, obesity is, as we know, childhood obesity, more broadly speaking, is a really important problem that needs to be addressed. Sleep is something that certainly plays into this, because what sleep does is it helps to activate those signals in the body that you are full when you're eating. So when you're not getting adequate sleep, you're not getting the signals to your body to tell you to stop eating. And then the other thing that can play into this is if you are not eating very healthy, that can lead to a sedentary lifestyle in which you're not getting adequate exercise, and that further can compound the issue of being overweight.
Okay, how about this one? You don't get enough sleep, so you have increased sexual risk-taking. I would never think that there was a correlation there. Why? Is it you're not thinking clearly? What's going on?
Yeah, so you talk about the role of sleep and how that impacts self-control, and then if you're an adolescent and you are faced with a situation in which you might have a condom that you can access, or you choose not to use a condom, that lack of forethought, that lack of kind of self-restraint can lead people to be more likely to have unprotected sex, to be having sexual intercourse with multiple partners in adolescence. So that's the type of risk-taking that research has linked sleep to.
Comprised immune system. Of course, you're worn out, you're worn down, right?
Yeah, you're more likely to get colds, you're more likely to get sick. It's going to take you longer for your body to recover from being sick. Because again, if you think about sleep as being restorative, not just to your brain, but your entire immune system, you're going to start every day being compromised, not having that full reservoir or tank of kind of the body's protective defenses.
And lack of sleep also leads into some depression and even suicidal thoughts.
Yeah, it is unfortunate, but that's probably one of the things that's been most well documented in terms of the link between sleep and these negative outcomes is the negative emotions like depression, suicidal thoughts. One of my studies showed that adolescents, particularly high school students who are getting below 6 hours of sleep at night, are significantly more likely to have attempted suicide as well.
Oh, wow. Okay. And so I guess the question is, what's the solution here?
Well, part of the solution is going to be the role of parents.
Right.
Encouraging good sleep habits, good sleep hygiene, starting very early in life, so that you can have kids develop those healthy habits. A number of the other factors are going to relate to that bedroom environment we were talking about, temperature, blocking light. But one of the other things that is going to be really important, I think necessary to discuss, is the role that schools play in terms of the time that school starts and how that can play into sleep patterns.
Okay, you're getting into our next block.
Yes.
That's going to be our next topic. We're talking schools, what can be done, what some school districts are doing, and what others may be considering doing as far as we're talking about sleep and your kids, and what's healthy and what's not. You're watching the Health Channel, All Health All the Time on South Florida's PBS. If you have a question, give us a call, 855-796-4475, 855-796-4475. You can take us with you by going to our website, allhealthtv.com, and download us. Our app is the Health Channel app on your mobile device, of course, your smartphone. It's free and available at the App Store or Google Play. We'll be right back.
The purpose of clinical research is to help understand how the human body works and how health and disease come about. So we want to understand what makes good health.
I think women's participation in clinical trials is extremely important because we have an entirely different set of issues, whatever body system you're working with. It's different from a man and from a child, so there are certainly differences there that we need to understand and focus and realize that are specific to women.
Science has shown and taught us that men and women are different in a variety of ways beyond the obvious differences. Our organs are different, our level of our hormones are different, we respond to treatments and medications differently. Based on those findings, every single cell in a woman or a man's body is a male or a female cell, and those cells respond differently to different triggers, to different treatments, and to the environment.
As a healthcare professional, a huge part of taking care of patients is educating them, and this actually gives me a great platform to reach a lot more people, so it's very exciting to be able to do that. Now, we have so many options when it comes to sunscreens out there.
Sometimes too many.
You go to, we have so many experts on the show. Each one of them brings something unique and special to the show and what they're sharing with the audience in general. So I'm actually absorbing a lot of that information as well. How important is having that relationship with a primary care provider? The stuff that's out there now is very, I like to call bubble gum programming, where there's no thinking involved. And this program actually helps you take in some education, some knowledge, and maybe learn something, and maybe even prevent something from happening health-wise.
It's been said that knowledge is power. So know that ovarian cancer has warning signs. Some may be subtle, but knowing them gives you more power to find this cancer early, when treatment works best.
First time I tried Vicodin, it was laying around my mom's house. And then I kept taking them whenever I could get them. I didn't know they'd be this addictive. I didn't know how far I'd go to get more.
Opioid dependence can happen after just 5 days. Know the truth, spread the truth.
We develop quality citizens who keep our core, our country, and our communities side by side on the winning side. Not for glory, but for honor. For a code that isn't written or spoken, but lived. It's what we do. It's who we are. It's the battle cry of our fighting spirit. Battles won. See all the battles Marines fight to win at Marines.com.
Welcome back to the Health Channel, All Health All the Time. I am Cynthia Demas. Joining us now is Dr. Ryan Meldrum, an Associate Professor of Criminology and Criminal Justice at Florida International University. criminology. This is the Health Channel. What's going on here? Well, I'm glad you asked. We're talking about how sleep affects you as an adolescent, the direct correlations to how it affects your life. And he has actually done a lot of research on this and is continuing to do research on the effects of sleep. That was our phone number there. We'd love to hear from you if you would like to join in on our conversation. 855-796-4475, 855-796-4475. So we're talking about the effects of little sleep that can have a variety of consequences on a young person's life. And we can't talk about that without talking about school. For kids, they have to get up, they go, and let's just talk about high school. This has been kind of brought up here, kind of brought up there. Kids, on average, high school starts at what time?
So in Miami-Dade County Public Schools, the average school start time is at 7:20 in the morning.
7:20, and high schoolers need that. Don't they go through that phase where they start to need more sleep in high school for brain development and everything?
Well, they don't necessarily need more sleep, but what happens is as adolescents go through puberty, and it happens to coincide in that shift from going to middle school to high school, what we call the body's circadian rhythm, or the body clock, shifts forward so that teenagers naturally, their body wants to go to sleep starting later in the night. So what you see is this compression happening where the body naturally wants to go to sleep later, but the typical high school start time is much earlier than middle school start times.
Which is, what's the difference?
So the typical middle school start time in Miami-Dade County is 9:10. So if you talk about an 8th grader, you might be getting up at 7, maybe 7:30, maybe a little bit later to get to school by 9:10. You're now, a year later, that kid who's now going into high school has to start school an hour and 50 minutes earlier than they were the previous year.
And I've heard a lot of arguments, well, we have the buses, right? So we only have so many buses in the county. We have to do one school, you know, the middle school, then we have to do the high school, then we have to do the middle school, elementary school. So it has to be staggered because buses are expensive, right? And then we've also heard, oh, high schoolers, you know, sports is such a big part of high school life. If they don't start at 7:20 in the morning, they'll never get out in time to practice their sport, right?
Yeah, and if you're a school district want to consider changing those start times, it is going to be a multifaceted, heavy lift to try to account for all these changes that are going to have to take place. What we have seen is some school districts have actually flipped those schedules, those busing schedules, so that high schools sometimes will start start after the middle schools, so that the high school students can get the more sleep they need with that shifting sleep phase. But yeah, the afternoon extracurriculars, sports schedules, all of those would have to be taken into account and adjusted.
It's hard.
Yeah, it's not easy.
It's a tough balancing act.
It's not easy, and that's why we've seen that even though a large number of states and a large number of school districts have attempted changing their high school start times, far fewer have actually implemented those changes because of those different barriers we've talked about.
The different factors. We do have a caller on the line who is going to discuss the lack of sleep as a kid versus now. What caller are you on the line?
Yes, doctor. I came down with the brain disorder when I was about 16, and I was in high school, okay? The original doctor said it was caused by stress due to the fact that I was in the process of going to early admission and, taking all these exams for entrance and all that. And one of the bad things that a lot of young people do all the time is they watch TV before they go to sleep. And they watch these very violent programs at night before they go to sleep. And they watch things about sports and, like when you watch the news, at the end of the news, they put the sports, right? And then what happens is that if you should be winding down to go to sleep. And later in life, when I was an adult, because of my brain disorder, I was working in a scientific field in the morgue shift, in the medical field, and I didn't sleep for like about 5 years because of the morgue shift, and then I went into a coma later in life, okay? And I was revived at the hospital, and I take Thorazine for my brain that I've been taking for like about almost 47 years.
Do you have any questions for our doctor?
Well, what I want to know, do you think it's a good idea not to let the kids watch TV at the end of the day?
Yeah, I mean, the general idea is you want to wind down, shut off technology at least an hour before you're ready to go to sleep. And I understand for a number of kids that that's going to be a fairly dramatic change for them because they're so used, their phones are oftentimes an extension of who they are. So again, that's going to really take the role of parents also stepping in to changing those habits so that you don't see those types of long-term negative consequences as our caller has talked about.
Right, because it is a serious one. And let's go back to, thank you caller for your call and your information. We wish you the very best. Let's talk a little bit more about schools and sleep time and what can be done. Go ahead and take a look at some information that you brought here for us. What are we looking at here? Is this your fancy work?
Yes.
Okay.
Yeah.
Talk us through. We got a flow chart here.
This is something I put together. It came out of a recent study that I had published that kind of is a visual representation of how we think changing school start times could lead to a decrease in delinquency and substance use. The idea is if you are delaying the school start time, if you're pushing it forward into the morning, whether that be a half an hour or an hour, that is going to lead to a certain amount of increased sleep the night before. And then as a result, you see there that the idea is increasing sleep is going to lead to greater self-control, increased academic performance. And we know that those two things, self-control and academic performance, are some of the strongest correlates or predictors of delinquency and substance use. So anything we can do to increase self-control and improve school performance, we think should have the downstream impact of reducing delinquency and substance use.
So where does this go? You do all this research, you come up with this great flow chart, seems really logical. Does this go to the school board? Where do we go from here?
So what we have seen already is that a number of school districts across the country have shifted their start time forward, particularly for high school students. And so what you've seen with those efforts is partnerships with universities, with researchers who have expertises in sleep to evaluate how that shift in the school start time has helped to improve things. The most recent study came out of the Seattle School District in Washington. They found that changing the school start time from 7:50 p.m. to 8:45 a.m. for high school students led to an average increase of 34 minutes of sleep per night. They found an average increase in grades of 4.5%.
Wow.
And they found that tardiness at school decreased significantly as well.
Wow, so there's some hard numbers there.
Yeah, the evidence certainly is accumulating, and I think as more school districts and more studies start to document the positive effects of the shifting school start time, that you're going to see greater efforts around the country for this to take place in more places.
And how likely, I don't even know if you could answer this, but I'll ask anyway. I think we're the 5th largest school district in the nation here in Miami-Dade County. What is the likelihood we would kind of see this shift happen? I mean, I've been to those school board meetings, man. They got a lot going on. There's a lot on their plate, and this would take a chunk of time. Is this something you could actually see happening here?
So I think what would probably happen is you would probably find a couple of schools that they might use as experimental schools where they're not going to change the entire school district at once, but they might have a couple of specific schools in which they'll change the school start times, see what happens. Because even though you see this evidence from other states and other cities, that doesn't necessarily mean that those benefits will translate in Miami-Dade County.
Right.
So,
or maybe in, we broadcast Monroe, Miami-Dade, Broward County. That's who's watching us right now. Monroe obviously has a lot fewer schools. So could you see maybe a smaller school district trying to take that on?
It would probably be less difficult for them to try to implement those type of changes. But you're still going to face the pushback from parents who are concerned with schedules and the issues around busing. So all of those things would have to be taken into account if you want to consider that type of policy change.
Nothing's easy.
Never.
No, but kids need sleep, and that should be about up here on the level of importance, right? Go ahead and take a look at some of the other tips that you brought for us here. Avoiding alcohol. Okay, let's see. Set a consistent bedtime. We talked about that.
Yeah, and start and doing that early on.
And that means on the weekends too. I mean, people want to stay up on the weekends, and it doesn't really work like that.
Yeah, well, one of the things that research tells us is trying to compensate on the weekends, trying to make up the catch-up sleep. It doesn't work.
No. Avoid alcohol, of course, because it affects your quality of sleep. Don't use technology in bed or have anything lighting up, right?
Yeah, again, really an hour before bedtime is when you want to step away from technology.
Okay. And then blackout curtains?
Yeah, that will help immensely with reducing any of that light pollution coming through your windows.
Okay.
Yeah.
And the temperature, the biggest takeaway, 65 degrees.
Yeah.
Freezing. I'm going to freeze tonight. Okay, but I'm going to sleep well.
Yes.
So is everyone else. Wow, great insight. Thank you so much for your time and your effort and your research into how sleep affects adolescents and how important it really is for their childhood and really for their adult life as well. Thank you so much. We hope to see you again very, very soon.
Thank you.
And be sure to join us next time on the Health Channel, All Health All the Time on South Florida's PBS. Follow us on social media at All Health TV, and be sure to visit our website, allhealthtv.com. Also, you can download the Health Channel app for your mobile device or your smartphone. It is free and available at the App Store or on Google Play. I am Cynthia Demas, and I will see you next time.